Greetings all, my name is Muhammad Yassin. Today I'm going to present about epigenetics, and I will take rheumatoid arthritis as case study. First, we need to know what is epigenetic. Epigenetic describes the process that control on-off of status of gene without changing the DNA sequence. There are many five epigenetic mechanisms such as DNA methylation, non-coding RNAs, histone modification, chromatin remodeling, and RNA modification. Molecular medicine is a division of medicine that explore approaches to diagnose and treat disorders by comprehend mechanism of cellular molecules, protein, and genes. Molecular medicine examines the pathological pathway of disorder by investigating mechanisms such as epigenetic, genetic, proteomic, transcriptomic, and pharmacogenomic. As a result, our knowledge has expanded, and our ability to treat diseases through personalized medicine and improve patient life, quality of life. Epigenetic and molecular medicine, there's actually four processes that is done in epigenetic, which include there's a writer process, reader, and remodeler. The writer is adding chemical modification to the DNA or histone protein, and the eraser is to remove reverse epigenetic modification that had been added by the writers. Reader act as mediator between DNA and repressive chromatin, and remodeler alter chromatin accessibility by repositioning or removing nucleosomes. And this is the mechanism. Clinical relevance of epigenetic in current practice. Clinical practice is influenced by epigenetic through the growing use of epigenetic markers and licensed medication target DNA methylation and histone modification, particularly in cancer therapy. These biomarkers are frequently used in tumor classification, early disease detection and diagnosis, as well as in other diseases such as rheumatoid arthritis. The uses of epigenetic has been used in many processes such as epigenetic editing through the Cas9. This is the process. It also used in precision medicine. Epigenetic alteration, particularly DNA, methyl, and histone modification, are valuable biomarkers in early detection, cancer prognosis, and personalized therapy in cancer and autoimmune disorders. DNA methyltransferase inhibitors can reactivate silence gene and combine it with the combine of epigenetic therapy with chemotherapy and immunotherapy had demonstrated promising clinical outcomes and enhanced therapeutic efficacy. We have also epigenetic clock. Epigenetic clock such as Horvath and Green age predict biological age, disease risk, mortality, and response to rejuvenation therapies. The liquid biopsy, nucleosome-sized cell-free DNA fragments released from apoptosis and necrotic tumor cell retain epigenetic information, include chromatin and DNA fragments, histone codes, and DNA methylation. For example, in a pediatric patient with high-risk neuroblastoma, epigenetic liquid biopsy based on DNA methylation increase the detection of the disease and improve the outcome. Now I'm going to talk about rheumatoid arthritis. Rheumatoid arthritis is degenerative bilateral polyarthritis that particularly affect the small joint. It causes chronic pain, loss of function and physical function, and low quality of life. There are many pathways included in rheumatoid arthritis. First, the pathogenicity. We have immunomodulators. Rheumatoid arthritis involve interconnected inflammatory signals pathway causing synovial inflammation and joint destruction. Tumor necrotic factor alpha, interleukin 1 beta, and interleukin 6 activate nuclear factor kappa B, enhancing inflammation and bone resorption through RANKL pathway. JAK-STAT signal, especially JAK2, disrupt their balance between T helper 17 and T regulatory cells, stimulate inflammatory fibroblast like synovitis. Mediators, macrophages 1 drive rheumatoid arthritis by releasing inflammatory cytokines, enhance fibroblast invasive, and promote osteoclast, mediate bone destruction. Disrupting between the M1 and M2. M2 actually is protective and release anti-inflammatory. The disruption between M1 and M2 status lead to persistent synovitis, cartilage damage, and joint destruction. Epigenetics through we have non-coding RNA, which is regulate inflammatory pathway and gene expression in rheumatoid arthritis. MIR203 increase interleukin production, and through interleukin 6 promoter hypomethylation, and histone modification such as histone acetylation and methylation regulate chromatin accessibility and inflammatory gene expression. So when we use histone acetylation inhibitors, exhibit anti-inflammatory effect in rheumatoid arthritis. DNA methylation is controlled by DNA methyltransferase and TEAD. As we mentioned before, there's write and reader. Global hypomethylation increases the expression of inflammatory cytokines, including interleukin 6, hypermethylation of regulatory gene disrupt immunity homeostasis. And we have also a chromatin remodular through tightness or loss of chromatin. This process is actually regulate transcription factor and RNA polymerase II binding. The metabolic effect on rheumatoid arthritis. The altered energy metabolism contribute to immune dysfunction in rheumatoid arthritis. The major pathway such as metabolic changes. We have also amino acid metabolism changes and lipid metabolism changes. All this actually will cause increase in the production of pro-inflammatory mediators and cytokines, which is increased the destruction of the joints in rheumatoid arthritis patient. The diagnosis of rheumatoid arthritis. American College of Rheumatology has actually set criteria score for rheumatoid arthritis. Any patient will come with these actually 5 criteria. Include joint involvement, serology, acute phase reactant, and duration. And there's a score here. Any patient with 6 or more out of 10, it will be diagnosed as a rheumatoid arthritis patient. We have the conventional diagnosis approaches in rheumatoid factor and anti-cyclic citronate peptide antibodies are the key serological markers. RF has rheumatoid factor has lower specificity but supported with ACBA. We have also C-reactive protein and ESR measure. It can be used as a score, but when it comes to the sensitivity, it has low sensitivity. The novel diagnosis approach, such as 14-33 protein, improve the diagnosis sensitivity when combined with the rheumatoid factor and anti-CCP. We have also calciprotectin. It also could be used to detect subclinical inflammation, and musculoskeletal ultrasonograph provide real-time imaging of the joints. The combination of multi biomarkers support assessment of incomplex or discordant clinical cases of rheumatoid arthritis. Now I'm going to talk about therapeutic choices. We have the conventional disease-modifying anti-rheumatoid arthritis drug, such as methotrexate, still used as first line. We have leflunomide, hydroxychloroquine, and sulfasalazine. The biological DMARDs, such as etanercept, infliximab, adalimumab, tocilizumab, sarilumab, and rituximab, in addition to abtacept. JAK inhibitor, also such as tofacitinib and baricitinib, are provide oral therapeutic alternatives for patients. Epigenetic drugs also had actually provide a good support therapy when it combined with other therapies such as conventional or biological. It increases the efficacy and synergize their effect. Novel approaches in treatment rheumatoid arthritis. We have the gene therapy. Gene therapy is aimed to support the pro-inflammatory cytokines or to increase the anti-inflammatory cytokines. So using adeno-associated virus as a vector to deliver any changes to therapeutic genes commonly that encode anti-inflammatory such as interleukin-4 and interferon beta. Also CRISPR-Cas and with nanotechnology based delivery enabled to precise gene editing in fibroblasts like synovosites and chondriocytes. We have CAR therapy and BiTEs. CAR as actually and BiTEs emerge immunotherapy in refractory patients. CAR therapy are engineered to eliminate pathogenic immune cell and provide durable remission. CAR therapy have some side effect which is considered fatal, such as cytokine releasing hormone and neurotoxicity, which leads to the excessive production of cytokines. While BiTEs, which is bispecific T cell engagers, provide an immune site actually in treatment rheumatoid arthritis, and with less cytokines releasing syndrome compared with the CAR therapy. Antibodies, therapeutic and next generation biologic. Japan has actually got approved for new TNF inhibitors, which contain two tumor necrotic factor alpha binding domain, one to TNF, and another one is bind to albumin domain, which increase the half-life of the drug and allow to monthly dose interval. We have also the role of artificial intelligence in rheumatoid arthritis. AI and machine learning improve rheumatoid arthritis and patient stratification and precision medicine, allow to precisely detect which defects in any pathway of for the patient and precisely treat those patients. In conclusion, targeted biological and JAK inhibitor improve rheumatoid arthritis control through precise immunomodulation, while methotrexate remains essential despite safety concern and emerging advanced therapy. For CAR and BiTEs, gene therapy and next generation TNF are considered new options for refractory rheumatoid arthritis. Epigenetic therapy regulates gene expression, reduce inflammation, inflammatory cytokines, and restore immunity, and decrease synovial inflammation, showing promising as synergistic and potential curative rheumatoid arthritis treatment. At the end, thank you for your attention. If you have any questions, don't hesitate to call me or to send an email in my email that in the screen. And thank you again.